Doctors and KEFA.
Good night, Barbados. Katrina Ali, president and founder of the Katrina Endometriosis Foundation, and I'm here tonight with the one and only
Queen Archie McCox, Labby Dabbies, I hear you flesh, living flesh. But you doctor, you know, you don't show you what that was about.
Right now, we are here talking about endometriosis and how it affects the urinary tract. From the last 2 episodes, we would have talked about endometriosis and making it clear that it's not a localized condition. And having endometriosis, you can have it on the bowels, as I said, the urinary tract, arms, legs, lungs, intestines, anywhere you can have endometriosis tissue. So today, as I say, we're talking about endometriosis on the urinary tract. Signs of endometriosis on the urinary tract: you would have the need to urinate frequently. You would have blood in the urine. You can have full bladders, and having a full bladder making you very uncomfortable. You can also have the need to urinate more regular than often, and this condition makes you very uncomfortable because then you are at risk for having incontinence, and incontinence meaning urinating without any control. So, you know, you can be out having a good time and, you know, you have a little urine trickling out because the bladder has been affected by endometriosis. What's wrong with you that you're dropping everything, sir?
The phone hearing probably before them man is a bar phone, so it's all right, just be there bar people saying you don't want to drop or hurt yourself.
So yeah, so you know, there are many women that have bladder issues, and sometimes it goes misdiagnosed because intestinal cystitis is also a urinary issue, and sometimes it gets misdiagnosed because the endometriosis has similar symptoms for this condition. I'm just here trying to get the video shared.
Before we go any further, I think. Okay, all right. Right, before we go any further, I think we need to thank all those people who came out on Saturday evening for Endomotion Level 2. It was very insightful and informative. You know, we had a fairly good turnout of the persons who suffered with endo, and some persons who suspected that they had endo, but they weren't quite so sure what they had. You know, that was having these awful pains. So they came to hear a little bit more about it as well. We also had the doctors on board.
Yes, JRB Medical Center. They did a really, really good job by explaining to the congregation and to the ladies.
Congregation of the church?
To the ladies. I said the congregation and the ladies because
men was there,
that's why it's news congregation.
But also congregation, your audience, congregation, so you're in church, you can be in church or something like that. You can be there.
You never know the way to behaving.
Oh, there. You should collect a little offering and then David sorrows and groceries this week. Just pass for your offering, talk for how good they're thrown in there. Right, so you were saying that the doctors.
Yeah, Dr. John Barker, he did a really awesome job. Dr. Griffith, Dr. Yarbuff, Dr. Waterman, and psychologist Brenda Roach, they did a really awesome job on Saturday. And I mean, they went into depth about endometriosis and how it affects the internal organs. We talked about all the opioids, all the pain management, you know, the colorectal endometriosis as well. And it was so educational because even seeing the videos from the surgeries that they would have done and seeing the endometriosis deposits within the abdomen and in the bowels was a wake-up call, because you know you know you have it, but then you actually see how it looks on the inside. It leaves room for thought.
Right, because that's the part that had me. I used to always thought it used to be like this lot of growth, like grass, you know, like a clump of grass.
Yeah.
I used to always talk about the deposits there. So I used to always feel it used to be like this clump of some tissue that just there.
Yeah.
But in some parts it was just a very small little thing.
Yeah.
Wrong side was just a small thing. Then he showed you some surgery they performed, and then some of the organs start to fuse together.
Yes.
And they had to go inside and separate the organs and take out some of the tissue and everything.
Right. Because last week, I remember when me and Christina was talking, we were talking about how when you had the surgery, then all the organs were fused together. So it was hard to get them separated, because some of the areas where the organs were stuck together, you could not operate how you would want to operate because of the risk factor of removing the tissue from these areas, you know. And even the bowels, to me, the surgery was like so complicated because it was so matted, and the length of time that they took to separate the bowels and everything from the tissue and to get out the endometriosis tissue. The process was a very, very, very tedious, I would say tedious procedure, because you had to be very, very careful not to damage the blood vessels and the other
The bowels.
and the bowels.
But the doctor said that some old lady he had a client at one point in time that she could not even stool.
Yeah.
Because it was just pressed down.
Yeah, the obstruction.
The obstruction just squeezed up.
Yeah.
Right? And he didn't think it would have been endo that would have been causing the problem. So he really went inside properly with another surgeon and then discovered that this was actually a problem.
Yes.
that endo was causing. So it was very, very, very informative. And I'm sorry that some of y'all who, you know, you didn't get the chance to see it and come and ask questions and everything. So it was really nice. Right, so thank you for coming out. And hopefully that next time we do such a seminar that you will be free to come out and participate as well. Right.
And before we go, the adolescence topic. The adolescence topic was very, very informative, because it's hard to treat a teenager with endometriosis because they have to go through so much procedures, especially one that is not sexually active. So you cannot do a physical examination with some person that is active. So you have to do different procedures. Sometimes the doctor was saying she had to sedate patients to actually have them examined because they were uncomfortable with the procedure, you know. So all these little things relates back to the psychologist with mental health and prepare yourself for the examinations that you would go through, trying to get to the root of the diagnosis. And as I say, it's not a diagnosis where you can have an ultrasound and say, well, look, yeah, this person has endometriosis, because it's not seen with the visible eye. So you need to have that laparoscopic surgery to diagnose the endometriosis. And to me, this is the setback. That's why diagnosis takes so long, you know, with females, because as I say, you get a lot of misdiagnosis happening. So even like with the urinary endometriosis, intestinal cystitis have the same symptom. So most people will say, you know what, it's probably intestinal cystitis.
What's that?
Is a condition that affects the bladder.
Oh.
So you would have the same incontinence, the same symptoms as if endometriosis on the bladder. And for me, if endometriosis on the bladder does not get treated properly, you can actually get kidney issues as well, because you know the kidneys function and you know the retention. And I've had issues where you were on medication for the pain, and the pain was that bad in the pelvic that it actually shut down the urinary tract from working. So you actually had to get catheterized to actually release the water. So all these are things that, you know, you need to take into consideration. Even some harsh medications also can give you that effect, especially morphine. Sometimes morphine actually stops you from passing water as well. And so having morphine to subside or to reduce the pain can actually cause you to have bladder retention as well.
Cool. You didn't know that. You know, teach me something. I tell you, morphine would be helping.
Yeah, the morphine is helping with the pain, but as I say, because of the dosage and the regularity of having the morphine, it sometimes gives you an obstruction down there in the urinary tract.
Okay.
So you would have to have then, if you don't have catheterization, but if you do have endometriosis on the bladder, most doctors would use a cystoscopy, which is going inside the ureter and looking inside with the camera to see the deposits on the bladder.
And then do what?
And then I guess they would treat it from there. They would decide if you need surgery to remove the tissue, or what would be the necessary procedure for that particular person.
Okay, that makes sense. That makes sense. All right. Oh, I said, what about TV to this evening? What about the hospital doing?
Well, last year we started the Endometriosis project, and this project consists of toiletries, sanitary napkins, roll-ons, toothpaste, washcloths, disposable razors, things that patients would need from a day-to-day basis. And you know, being in a hospital for so long and so often, sometimes you meet people that are there on emergency. You're at work and you have a miscarriage, you have a flare with endometriosis, fibroids, adenomyosis, anything to do with the pelvic. You might have, as I say, endometriosis flare, and sometimes you come into the hospital, you know, you go through A&E, go through casualty, you know, you go through the process, and still you have to wait for your loved ones to bring you your necessities. So this project was there, put in place to help those who were hospitalized, and not just emergencies, but those who were less fortunate for supplies. So we did that tonight. Not tonight, we did that this evening. And this morning we had the official launch at the QEH hospital ward before we adopted the ward officially. So this would be our, I would say, our baby, because we are going to be nurturing it every 3 months. We're going to make sure that, you know, all the necessities are there, whether it be sanitary napkins, toiletries, or even simple things like milk, tea, sugar, etc. Things that patients need, because sometimes when you have a surgery, you don't eat anything sometimes for days, 1. 2, depending on the procedure you're having and the weight. 2, when you come back from surgery, there's so much air built up in the system. And this is the #1 complaint for patients that have surgery. So we made sure that we had like ginger teas and, you know, the normal teas that would help with the coping, because sometimes even when you come back from surgery and try to like drink or eat, you start to vomit because your stomach is so upset from the anesthetic. So these are things that we're trying to put in place.
May I ask you a question?
Yes, please.
So what hospitals have provided these things?
It's not a matter of the hospital providing.
Oh, yeah, that's a question, you know. I would think the hospital got toilet paper and sanitary napkins and everything in case the bug blow. You at work and you take in and you fly to the hospital, you go get for somebody. You should take the hospital, got ginger tea and all the things there, so you know,
Well, you know, times has changed, and you know, this harsh economic times. So, you know, it was on the association to give back. And as I said, being there myself, I know how it is to be in hospital for a period of time and waiting for loved ones to bring in necessities, as I say, when you have an emergency. So I think that it was a good gesture, and for me, giving back is what I want the association to do.
I would let it give you back. That'll make your bar from me to ask me.
Which one is the one that you?
The one that you borrow from somebody, that you borrow from me, but they back, you will let it give back that way. And you'll read that and another distraction. People here looking at me. Right. So I guess I know that some of the funds that you all raised from like the seminar thing,
yes,
you use some of these funds then to help out
yes,
at the hospital.
So,
but if that, so what about corporate barbers? You can't beg them for their Darcy or their David to come to any jar. You know, some places that they sell sanitary napkins and
yes,
sell alcohol and different things. just to get it.
Definitely
They
want to
always
reach
true.
out to Bradens because they carry the always pads that we normally use.
So you beg them Bradens, yeah, like directly.
Yes, we can beg Bradens. So
Okay,
Bradens,
bro.
if you want to hear me, we need your assistance. Massey, they are the carriers for Stay Free.
Imagine some ramen there for me too. Wait, bag him up.
Cherish.
Oh, yeah.
Queen what ramen.
You got to her, it's all between me and you.
You know, but any area that you guys can help, we would like y'all to come on board with us because, as I say, it is a project that we're going to be doing every 3 months diligently. So we are going to be reaching out to organizations, corporate Barbados to help us. It's not about money. We need the assets. So money is not an issue. So we are not going to ask you for $1,000. If you can have $1,000 in items from whatever you provide, that's fine by us.
And even the people here on Facebook and social media too, you know, you can message the people and the endometriosis thing here on Facebook. You can send a message saying, okay, I've got a big lot of nothing, but I give, I can buy so and so and so and so for you. And drop it off at so and so and so and so. Well, every little bit does count, right?
It's true. And I want to say thanks to the Miato Foundation. Embassy did it itself. Embassy would have donated some sanitary napkins and some of the little items that we would have used as well in our care packages from December and also from today. So I want to say thanks again, Embassy, you and your foundation. We're looking forward to doing some more collaboration. So any organizations out there that want to come on board with us, we welcome you with open arms because collaboration is something that we look forward to as well as an organization.
Yeah, that makes sense. And I think you've got a lot of women involved in sports, you know, the sports clubs and things, can put it in something. Well, the package will also they say to keep it as well.
Yes.
Right, so that's a good thing there. So, all right, I hear you might go again a trip overseas to go and discuss the endo thing in Barbados and what affecting Barbados and things like what them big players is.
Yeah, well,
you want to buy the family, so I have to.
Yes, I want you to come and help.
Okay, good.
But the only thing we're gonna put muscle for you, cause you know you don't got the love behavior.
No, it's very straightforward. And, you know, what is this about doing talking?
The Yellow Kit Endometriosis Foundation. They came on board with me. I met them in 2016. Worldwide organization of endometriosis when we were first acknowledged, when Barbados first got on the map for having an endometriosis association in 2016. And I had met Tara Chavez. She is the president and founder of the Yellow Kit Endometriosis Association in Delaware. And they would have contributed to our first EndoDrive project as well. Even the second project they had contributed as well. So they are having a big conference in Delaware and a big Endo Fest celebration afterwards. So I am going from Barbados to represent Barbados. I'm talking about endometriosis, the work that we have done so far in Barbados for endometriosis. And, you know, getting Barbados out there, because everybody thinks Barbados is just about music and about beaches and stuff, but actually having an endometriosis foundation that is recognized worldwide, you know, it has been a blessing. And sometimes, you know, you still look at it as a curse, having endometriosis and this debilitating condition that, you know, could take a toll on you, but it has also been a blessing. And I just want to say thanks to the Endometriosis Yellow Kit Foundation for inviting me to Delaware. I'm so excited. Never been to Washington, D.C. before.
Delaware, so you talk about Delaware there, so about the hospital?
No, I talk about Delaware in the U.S.
Okay.
Also, we visited Washington, D.C., Philadelphia, and Jersey as well. So, you know, this is going to be a very, very interesting endometriosis month, and I'm really excited about it.
Okay, somebody is asking a question. Jacqueline is asking, is it preferred to donate to the ward or to the association to distribute the supplies?
To the association. When you donate to the association, of course, the donor would be mentioned as well. So it's a process. You just can't walk up to the hospital and say you're going to donate some items. It's a protocol you have to go through. You have to send in your letters, get approval from both the CEO, nursing office. So it's a lot of red tape that you go through. So yeah, basically.
And to contact you, you just come to your page between Endometriosis Fund.
Yes, you can contact me. There's a number on the page as well for contact. There's also an email, so you can contact me directly. You can contact me by email. You can contact me from the page.
Are you gonna contact me to, the phone me because I ain't gonna check up 19. I ain't laughing away.
Yes, or you can contact the Queen.
I ain't gonna check up 19. If you say something, you hire a thing. Oh, that's it. But I live ramming. So check up little something or that reason the pot thing. But the other stuff here, make sure the other stuff get passed on. There's no problem with that. Yes.
I think because you know you again don't know.
Good. That's not age. Right. She said because this.
Thank you, Jacqueline.
That'd be it. Yeah. And the other people who watching the video, or you know people and think you want to donate and stuff, all that there so is welcome. Well, as I say, you can't expect the government to do everything. If you go and reach out something to help you one another, right? You can't put all the burden on the government. Because if you can help you one another, we help you one another. Hey, that's what I tell people.
Sanita here, you are saying that you went through it all, so I understand what you went through, Katrina. Yes, nobody do not understand the extent of what endometriosis do to your body unless you have experienced it. People can sympathize and empathize with you, but until the shoe is on that person's feet, they can only assume. And sometimes they say things like, oh, the pain can't be that bad, or you don't look sick. But we hide behind a mask daily because we do not want, as I say, stigma attached to us. We do not want pity. We do not want people to feel that we are inferior, because people think because you have endometriosis, sometimes you are bedridden, that you are less of a person. But you see, on a good day, you function at 150%. You understand, especially if you are some person that is determined not to let endometriosis define who you are. You definitely have that chance of putting yourself out to depression, because sometimes you get depressed to the point where you don't want to do anything until you don't want to get your bed. If you get your bed, just want to get your bed to bed and lay back down, because the pain is so great. So you don't want to be in a situation where you're out mingling and the pain bad. So it is a lot emotionally and mentally. So sometimes people might say, you just get really emotional when you talk about endometriosis, or you just hear the passion in your voice when you talk about endometriosis. But when you're passionate about something, or you have been through something, the only person that can tell your story is you.
I know one of the lady, psychologist lady, who's your name again?
Dr. Brenda Roach.
Sorry,
psychologist. Everybody gets you this doctor title, so I tell you, what, you better up your thing.
She was saying that people go into depression, strong depression, and sometimes people in a relationship, the relationship actually breaks down because the woman is not in a position to really communicate to her partner what she is really going through. And so suddenly the partner just believes that she tried to be for the thing from me, what I mean? She did what you know. Right, that's what I'm saying. No, suddenly she says suddenly the partner genuinely believes that she just looking for excuses not to share the honey with she. I didn't even hear some woman say that at one point she was saying she must be going on a man though, because every time he pull out, she talk, she barely heard it, she back heard it, and all kind of thing and all kind of. So suddenly they can have that kind of mental strain on relationships as well, right? And
that's why I said men need to educate themselves, because even today, one of our ambassadors, Ambassador Shirley Stewart, he was there as well, doing a presentation with the organization, and the media was asking him some questions, and he was saying that he had a person a while back that had endometriosis, and he was there to see the flares behind the scenes, etc. And it was not a good experience for him, because when you love a person and they're in so much pain and there's nothing that you can do physically to remove that pain from that person. You know, so I keep telling people endometriosis is not a woman disease, it's a family disease, because the trickle effect on relationships, on families, you know, is very impactful. And I think that we as a community or a society need to crack down on stigma. Because back in the day, I've spoken to women, I still speak to women that say that people would say, oh, your belly bad and stuff because you're bleeding or you're having miscarriages, or, you know, there's something going on with the abdomen.
But so, the women who is get on with that kind of slap behavior,
Yes.
The women who curse one another, tell one another, well, your belly bad, you can't get the children, and blah, 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 blah.
Men too.
I know men to do it too, but I told some the same women, some same women who should know better.
Exactly.
The school is doing a lot of that there.
Exactly. And the thing is about it, even some that suffer with the same condition, that some people that have children, some that don't have children, and they look down on the ones that don't have. And to me, it doesn't make sense to me, because remove the children, you and I in the same position, and sometimes you're in a worse position than I am, because people, you know, they used to say, oh, babies can cure endometriosis. I've known people and I've seen people living proof that have babies on top of babies, just hoping that it cures endometriosis. And to me, it was just a waste of time. The only thing you get a break is from the period. That's the only thing that happened, and everything went back to normal, you know. And some people pain lessen, and some people get worse. So, you know, people say, oh, you could get a baby and get endometriosis cure. If that was the case, I must have had 1 million children. I would be like the woman that live in the shoe. Real thing.
All right, so we running off here, so I know. Is there anything else you want to share with people?
Yeah, I just want to say thanks to Ward before, all the nurses for doing a really good job, time after time, you know, taking the time out to assist us ladies. And, you know, I think that we are the most, I would say the most patients that get your attention because of, one, however we need to get the medication. Two, if there's a flare or if there's a situation where endometriosis affects something else, such as the lungs, or even if we have heavy bleeding that we cannot even get off the bed, that y'all have to bathe us. I've had those days. So I want to say thanks to Ward before for making us feel like, you know, that we can be comfortable, you know, something like a safe haven. So, you know, I guess that we want to say thanks to you. I can't thank you enough. I want to say thanks to all the doctors that are doing a really good job. JRB Medical Services, I want to say thanks again to you for coming on board with us. And I hope that, you know, you will continue to do a lot more for endometriosis sufferers. I want to say thanks to the media and stuff for coming up today and, you know, helping us to get the EndoDrive project out there. Thanks to all those who would come on board with us to assist in any way. I want to say thanks to my team, my committee. You know, my committee has been doing a really good job. I want to say thanks to the ambassadors, Eric Lewis, Shirley Stewart, Saint Sima, you know, all the entertainers that would have came on board with us, especially throughout the years. You know, Edwin Yearwood, I want to say thanks to you again. Still looking forward to working on that project. So everybody that has played a part with this association so far, I want to say thank you. Thanks to all the viewers. I would not be here for the next 2 weeks, so there will be no Scars and KEFA for the next 2 weeks. But trust me, when we come back, we will be on fire, because it's going to be a whole different can of worms when I return. Because all the knowledge that I would have gained from over in the US, I would then deliver to you guys and help further educate you on what endometriosis is.
Okay. All right, thank you very much, everybody. Thanks for tuning in. Remember to share the videos, but even when it finishes, share it with your friends and your family. I'm looking forward to seeing you when Katrina comes back from Washington and touring the world with Rihanna. Thank you very much. Enjoy.